This video is going to go over the benefits of the HSA PPO plan for Autism Learning Partners employees for 2023. HSA plans are unique, and we hope that this will help answer the most common questions on this year's plan. The United Healthcare HSA PPO plan uses the same network of doctors as the traditional PPO plan that is being offered this year. The HSA plan does not require you to pick a primary care doctor. And this PPO plan has both in-network and out-of-network benefits. However, it is always best practice to try and find an in-network provider with United Healthcare so that you can get the benefit of the negotiated rates for services. When you go to an out-of-network provider, United Healthcare does not have a contract with them, and it is likely that you will pay more for those services. The United Healthcare HSA is a high-deductible health plan that allows you to set aside money in an HSA account at a bank of your choice. The money in this special savings account can be used to pay for medical expenses on the plan. Autism Learning Partners will reimburse the first $200 that you put into your HSA account and will reimburse you a maximum of $400 if you enroll another dependent or your entire family on the plan. The contribution limit for an individual is $3,850 each year and $7,750 for a family. You must have an HSA plan in order to open and contribute to an HSA account. When you go to do your taxes, be sure to let your tax preparer know that you contributed to an HSA account. You will be eligible for a federal tax deduction for any of the money that you contributed to the plan within the plan limits. Here is how your HSA plan works. The plan has a $2,000 deductible for yourself and a $3,000 deductible for your family. The out-of-pocket maximum is $4,500 for an individual and $9,000 for the family. Since your plan has a deductible, you will need to pay for all services until you meet the deductible. And, once you've met your deductible, you start sharing costs with your plan called co-insurance. You continue paying a portion of the expense until you reach your out-of-pocket limit. From there, your plan pays 100% of allowed amounts for the rest of the plan year. Please note, HSA plans are unique. Once you enroll an additional member on your plan, the entire family is subject to the family deductible. Additionally, there are separate deductibles accumulating for out-of-network services. The annual out-of-pocket limit includes co-payments for United Healthcare benefits, including behavioral health and prescription drug benefits. The key benefits of this plan are as follows. Preventative care is covered at 100%. And remember that some preventative care screenings are based on age. This includes services such as routine wellness checkups, immunizations, and lab and X-ray services for mammogram, pap smear, prostate and colorectal cancer screenings. Earlier, I indicated that the HSA plan has no first dollar benefits until you reach your deductible. Other than preventative care, the rest of your benefits are covered after the deductible. The primary care office visit is 20%, and the specialist visit is 20%. These are the charges after the deductible has been met. Therefore, if you have not met your deductible, you will pay the negotiated rate for a doctor visit. The cost to see an out-of-network provider will be more as there is no negotiated rate for that provider. If you need to go to urgent care, the cost is 20% after the deductible. Many employees think that the emergency room is always the best place to go, but we all know an emergency room visit can be expensive. As an alternative, there are many services that can be provided at an urgent care office. Typically, the urgent care office is open later than your doctor's office. The waiting room is usually less filled and they tend to take patients in on a first-come, first-served basis. In the end, going to an urgent care office rather than the emergency room can end up saving you time and money. If you are hospitalized, you will pay 20% co-insurance after the deductible. If you need an outpatient surgery, You will also pay 20% co-insurance after the deductible. As a reminder, your employer offers a hospital indemnity plan through United Healthcare that can help put money back in your pocket if you have an expected or unexpected hospitalization. You can take a look at this plan during the online enrollment process. Lab tests are covered at a 20% co-insurance after the deductible in a freestanding lab. Lab tests performed in a hospital-based lab or an outpatient hospital diagnostic center are covered at 50% co-insurance after the deductible. Out-of-network lab testing is not covered. For services provided at a freestanding diagnostic center or in a physician's office, the charge is 20% co-insurance. And for services provided at an outpatient hospital-based diagnostic center, the charge is 50% after the deductible. If you end up in the emergency room, you will pay 20% after the deductible. Similarly, the ambulance charge is 20% co-insurance after the deductible. This might be a good time to mention that if you enrolled in the United Healthcare Accident Plan, and your emergency room visit is due to an accident, you will receive benefits from the accident plan. After your claim is approved, the benefits are paid directly to you. And you can use them to pay bills or for anything else you may need at that time. If you are not familiar with the accident plan, you can learn more in your online portal through ease. It is extremely important to note that on an HSA plan, your prescription coverage is subject to the medical deductible. After you have met your deductible, the cost of the prescription depends on the category of prescription that you take. The Tier 1 prescription cost is $10 for a 31-day supply. The Tier 2 prescription cost is $35 for a 31-day supply. And the Tier 3 cost of a prescription is $70 for a 31-day supply. If you need any maintenance medications, you might be able to save some money with a 90-day supply through mail order. This can save you time because the prescriptions will be mailed directly to your home, rather than picking them up at the pharmacy every month. Typically, your doctor will need to rewrite your current prescription for a 90-day supply, so that you can start the process. You can reach out to us if you have any questions on the mail order program. Before we move on to finding a provider, I wanted to make sure that you knew about the HSA Fun Facts document in your portal. This document has listed many of the key points about the HSA plan and the benefits of an HSA account. Please take a look at it as it can answer some additional questions that we may not have addressed online today. We just went over the medical benefits of the plan, but you also need to know how to find a doctor in the HSA plan. You have to make sure that you select the correct network when using the provider search. In this case, we are searching in the Select Plus network. Here are the steps to locating your provider. Go to myuhc.com, then click on Find a Provider in the middle of the screen. You will need to choose from the Select Plus plans. The correct option is Select Plus. The last step requires you to put in your zip code to help you locate providers in your area. And then you need to choose the type of provider you are looking for. Once you have located the provider, it is always good to check if the doctor is accepting new patients. Otherwise, you may not be able to see that provider unless you are a current patient. It is important to note that at the top of your screen, it should indicate to you the correct plan network. In this case, the plan name is Select Plus. This is a good way to double-check that you selected the correct network. I hope that this presentation has answered some of the most common questions with your medical plan for 2023. If you have any additional questions, please do not hesitate to reach out to us. And as always, thank you for taking the time to listen.